energy intense process, how much glucose is needed, how much calcium is needed as well for first responders, for neutrophils to do their thing. And so again, we can add that robust yet regulated immune response to the list of other reasons why we really got to try to dial in nutrition and management.
Welcome to Rumination, the podcast that discusses and shares practical information that impacts the dairy industry and the rumen industry around the world. Hi, this is Chris Gwynn, and today we'll be visiting with Dr. Stephen Leblanc of the Ontario Veterinary College, University of Guelph. Dr. Leblanc is a veterinarian and professor working in the area of dairy cattle health management with a research focus on transition cow metabolic and reproductive health and management. He's a faculty member of the University of Guelph and Ontario Veterinary College, teaching veterinary and agricultural students while also providing clinical farm services to dairy producers in Ontario, Canada. A graduate of the University of McGill and the Ontario Veterinary College, he received his DVM and DVSC from OVC. Dr. Leblanc's keen interest in proven abilities in research and collaboration has led him to become a director of the Dairy at Guelph, the Center for Dairy Research and Innovation, which is uniquely a network of faculty, postdocs, and graduate students across all disciplines at the University of Guelph who do research related to dairy production. Dr. Blanc has given back to his industry while serving as a section and senior editor of the Journal of Dairy Science, past president of the Dairy Cattle Reproduction Council, and is currently a member of the board of directors of the American Dairy Science Association. A highly cited author of research, in 2019, Dr. Leblanc received the American Dairy Science Association Zoetis Physiology Award. And it's a great honor and pleasure of mine to be visiting with Stephen today. Dr. Blanc, welcome to Rumination. Thanks for joining us.
Thank you, Chris. I'm really happy to be here.
So let's just jump right into it. Postpartum uterine health, inflammation, immunity, impact on reproduction. It's an area of a lot of your research. So how come? What's it about this area that really intrigued you to dig down deep?
Well, I think it's a really interesting scientific challenge. There's a lot of complexity and interest here, but more to the point, it looks to be something that's got some real practical importance. So we know that calving is an inflammatory event, necessarily so. The birthing process involves setting off of a bunch of inflammatory processes and cascades. And even in the best case scenario, there's going to be some tissue trauma and some bacterial contamination of the reproductive tract after calving. And so the cow has to respond to that. And part of that's an immune response, an inflammatory response to repair tissue damage, to clear up some of these bacterial contaminants and keep the load of potential pathogens in check. So there's that physiologic side, but we know everyone from, a hardcore researcher to a very frontline farmer can see with their own eyes that, some cows come through that really well. Other cows kind of fall off the cliff and have retained placenta, have metritis, have chronic smoldering problems that we diagnose as pus discharge or endometritis or both. And so we're really, and that's common too, that those problems, depending exactly how you count them and how carefully, are affecting anywhere from 5 to 25% of cows. And so clearly they're a problem for the fertility and performance of those individuals. And when we start getting into problems that are that common, that becomes an issue, not just for those few odd cows, but for whole herds. And so fundamentally, those are kind of the principles and the starting point, but the real challenge we have that we're still finding our way through is understanding the why. Why is it that, two cows, which outwardly seem to have the same risk profile, one of them sails through calving without any troubles and gets pregnant on her first or second service, and why does the other cow that appears more or less the same as the first one, why does she wind up with uterine disease or either not enough of an immune response or not a well enough regulated immune response that leads her to be in this sort of state of persistent inflammation?
Yeah. And on that, and you kind of highlighted You talked about, I think, 5 to 25%. So it's relatively, I'm going to say undiagnosed, but maybe that's not fair. Tell me about how well we're capturing the information and awareness of these reproductive challenges post-calving.
Yeah, so maybe not well enough. And so if we think about, let's go with metritis. So that's a cow, first week postpartum, sick cow. The cardinal sign is that she smells really bad, fetid discharge. And that actually, from some barnyard microbiology, that tells us that she's got an infection with anaerobic bacteria. That's what makes it smell bad. Same as, foot rot smells bad, and it's actually some of the same bacteria. And so, you're not likely to miss those as a producer. But interestingly, so even if we say that that's the case definition, if detection is a little bit passive, you notice the cow when she comes in the parlor or when you're walking the pen, as opposed to if you're, locking the fresh cows up every day or every other day and really proactively going hunting, even by the same definition, and on one end, you might say, well, I've got, 5% of my cows that have metritis. Same definition, you could easily say I have 20% of my cows that have metritis. And I don't know which one is actually the better approach. One is probably underdiagnosing. One might be overdiagnosing if you're doing that every day, because there's certainly some spontaneous cures. But so that's one of these sort of on the one hand, on the other hand. For sure, when we get out to a month postpartum, thinking about cows that are not visibly or overtly ill, don't smell bad, don't have a fever, aren't off feed, but have this pus discharge sitting in the reproductive tract if you go checking with a MetraCheck or your gloved hand or whatever. And even more than that, endometritis, which requires actually, getting a sample from the uterus with a brush or with a little saline flush. That's, other than in research, that's almost completely undiagnosed because that's just not very user friendly, and totally understandably. So that's something we're working on. But so we've got this probably a little bit of a tip of the iceberg phenomenon. Those metritis cows that we find are probably just the tip of the iceberg for the bigger picture here.
And I guess for all that she goes through, it shouldn't be surprising that the high level of risk of infection is there.
Yeah, absolutely. And again, I think, the glass is half full in the sense that, even though these problems are prevalent, still the majority of cows come through this very substantial challenge well. And although we don't have a great list, if somebody said to me, I'm specifically interested in uterine health, what should I do? What management strategies, what nutritional strategies should I follow to really hone in on that? On the one hand, I don't really have that list, not very well. But on the other hand, it's, if we go back to kind of first principles, if you zoom out and say, well, what should I do to have healthy cows, whether that's, avoiding metritis, mastitis, metabolic disease, etc. I guess the good news is that those lists are pretty similar. A lot of the good and right things, best practices for how to manage, how to feed cows, how to support them through transition are very plausibly going to support robust, effective, but well-regulated immune function, kind of the Goldilocks. We've got Goldilocks diets. We're probably the latest now is thinking about Goldilocks inflammation.
Okay.
And so, that list of best management practices, I think, is still holding up really well, even though there's a lot of specifics that we still need to work out.
So Goldilocks inflammation a little bit, but just not too much.
Exactly. And I think, I don't know if this is absolutely the first, but if it is, we can both feel proud that you heard it here first. Never mind just the Goldilocks diet. We've got the Goldilocks inflammation.
Wait, maybe beat Lance to that.
Oh, I hope so. Yeah.
You recently published a review on and this brings it back to relation between metabolism and immunity, and I think in that case, more specifically to neutrophil function. And just wondering for the audience if you could summarize some of the key points of that review and how it relates to fresh cow health and reproduction.
Yeah, so I guess some of the highlights there would be that um, actually both for the udder and the uterus, but specifically for the uterus, by far the number one line in defense are neutrophils. So meaning the innate immune system, or in English, the non-specific. So in other words, this isn't something that we can do much for with vaccination, at least not directly, but rather this is, people, the analogy is sort of the fire department or the police department, when the first responders, okay? And so they're not, these cells, these neutrophils are like little Pac-Men, and they will go around and gobble up bacteria or even bits of dead tissue that are not normal. So those are the first responders. And probably the single biggest, or the first thing, I guess, first big thing is that there should be enough of them and that they get there quickly enough and in sufficient numbers and get the job done, to pursue the analogy that the house isn't burnt down before the fire department gets there. And so that involves, again, generally feeding the immune system, because there's lots of work that shows that those first responders require a lot of nutrient inputs, energy, antioxidant, vitamins and minerals, etc. And so if those things are in limiting supply, that's a problem. Or conversely, by feeding and managing cows well, we provide those inputs, that equipment for the first responders, so to speak. We know from some of the work done at Iowa State and elsewhere now as well, that's a very energy intense process. How much glucose is needed, how much calcium is needed as well for first responders, for neutrophils to do their thing. And so again, we can add that robust yet regulated immune response to the list of other reasons why we really got to try to dial in nutrition and management. The whole thing of stress is a bit vague and overused, but it's also true that to the extent that cows have social stress, heat stress, other kinds of pressures that either because that affects their nutrient intake or because they're somehow truly, stressed, socially stressed, all of those things are going to work against them having the kind of robust, effective immune response that we're looking for. Last but not least, the part that we understand a lot less about is sort of the backside of that response curve. We are focused a lot on the response time, are the first responders sufficiently fast, sufficiently well equipped, and so on. And clearly that's got to come first. But when we get thinking about chronic smoldering reproductive tract inflammation, endometritis, that probably has a lot more to do with how effectively that dial is turned back down again in the days or weeks once that initial response is over. And that is a really hot area of research in human medicine that we're just scratching the surface of with cows.
Can you want to expand a bit on that? So that they have this response, but then they come back to normal quickly is important?
Yeah, exactly. So we think that if you could draw a visual of a healthy neutrophil response or immune and inflammatory response, it would happen very quickly, sort of hours to day or two after calving. So accelerate very quickly, probably hit its peak in days, so within a few days after calving, and get the job done. Uterus isn't sterile, but reduce the level of pathogens back down to a very low kind of background level. Deal with the tissue trauma, help initiate healing, regrowing a new epithelium so that over weeks that the cow is ready and able to be pregnant again. So again, that should all happen in sort of days to a couple of weeks. And then that inflammatory state is dialed back down, not to zero, but to kind of a low baseline level. And we think that is by about 3 weeks postpartum in a healthy cow is what we're looking for. And again, the part that we think we understand a decent amount about the front part of that curve, what supports the speed and efficacy of that response. And for a long time, the thinking was just, well, okay, and then kind of once that's done, once there's no more flames, well, that's it. They shut off the hoses and everybody goes home, and it's kind of a passive thing, like, take away the alarm and then everything just sort of falls back down to its natural level. And that may be true in some animals, but it's becoming clear that what we refer to as dysregulated inflammation, which is kind of a $5 word for we don't really understand why it's turned on. Because, for example, in a lot of cows with endometritis, if we go looking for this sort of chronic smoldering bacterial infection, we don't find it. It's what's referred to in human medicine, we think, or that's the concept there, is sterile inflammation. It's probably not literally sterile, but it doesn't appear to be that the cow is just locked in this stalemate of bacterial infection that she sort of can't go forward or back. Rather, it seems like she did get ahead of the bacterial infection, and yet, or despite that, inflammation remains sort of turned up too high. Not so high that you would pick the cow out as being obviously sick, but if you could, put on your X-ray goggles, what's happening in her uterus, there's still this kind of smoldering inflammation going on there. And so we've thought about, are there bacteria there that need killing? Maybe in some cases, but clearly not in all of them. And there's been a number of studies trying, using anti-inflammatory drugs. And so far, that's been almost universally disappointing. Now, maybe we just haven't used the right drugs or the right timing or the right doses or something. But so far, that's been pretty much a bust. But there's some really interesting stuff it's for the future at this point. But looking at chronic inflammatory diseases in people where they've kind of really shifted their paradigm in the last 10, maybe 15 years to some really novel approaches to trying to regulate that. And we're certainly not there yet in cows, but I think that's where we're gonna go next, or one of the
keep my eyes and ears open to those type of therapies or approaches.
I mean, right now they're expensive for people, never mind for a cow. But I think we can at least learn some things there and hopefully find some approaches then that are appropriate for cows. I mean, for example, people have looked at, can we dial in or fine tune fatty acid nutrition for cows? There are certain fatty acids favor inflammation, others tend to favor resolution or be anti-inflammatory, so to speak. Again, that's not new. We also haven't quite figured that out in a way that's really practical for application in the field yet. But I think that's one that one's within grasp if we can make it that last couple of miles to really get our hands around it.
Yeah. Could we feed that specific group of cows a specific fatty acid diet that would help alleviate?
Yeah.
We'll get there.
That's one of the challenges, right? Is that the science of that is pretty decent, but the delivery is really tough because you're trying to target it to, small windows of days in milk. It's pricey, etc. But you think about where we're going with feeding cows in this, so-called precision feeding, whether that's through a robot or other technology. Again, that's not so far-fetched anymore. Once we can do it, once we've got a little bit better figured out exactly what we're doing and how.
No, absolutely. And I'm glad you brought that up. And, and I just thinking one of the points I neglected to ask is that having good uterine health is good for reproduction, right? We didn't really talk about the numbers, but the impact of poor uterine health on reproduction is pretty significant.
Yeah, absolutely. So, I mean, just to put it in pragmatic terms, cows that have or live through any of metritis, endometritis, purulent vaginal discharge a month postpartum, ballpark figures, we're talking 20 to 30 plus extra days open, and 20% more, relatively speaking, cows that will fail to get pregnant by, 250, 300 days in milk, by which point it's too late
They're
for
going to be
them.
called.
So this is a meaningful problem. And again, at those prevalences of, 1 in 5, 1 in 4 cows, that can certainly start to become a meaningful thing, not just for a few exceptions, but actually a meaningful slice of a herd.
Yeah. No, and thank you for reminding us of that. So if we were just to summarize, and I know you touched on it, but if we were talking to a dairy producer or a nutritionist today and reminding the importance of improving uterine health without having that magic recipe, it's looking after transition cows. You want to just highlight a few of the key things that you feel are really important to remind ourselves on?
Yeah. So, and again, no marks for originality here, but I do think it really does come back to some of those really fundamentally important things. I mean, I'm always reminded, you go to producers who are really just doing great health, great production, high pregnancy rates. You ask them what their secret is. And I think almost to a person, in my experience, they're like, well, I don't know. I don't do anything special. I don't have the secret supplement or the secret technique. And ultimately, they're just the ones who get the basics done in a very consistent, comprehensive way. So what does that mean? I mean, right up near top of my list would be sufficient space for feeding and lying for transition cows. So although it's, the evidence base is not as big as we might like it to be, having, no more than 4 cows for 5 headlocks, or at least 30 inches of bunk space per cow, a little bit more cows than stalls, and or 120, 130 square feet of lying space on a pack situation for transition cows. Abundant water, so 2 sources per pen, 10 centimeters of linear trough space per cow. Again, no marks for creativity on any of this stuff. Heat abatement for not only for fresh cows, but also for close-up cows. Again, sometimes like producers are like, I heard all that, but, and I'm only doing part of it because life is difficult and, it's complicated. But, what else can I do? Is like, well, I get it. Like the whole art of farming is figuring out how to get as close as possible to doing those things. But really, if you can get those things done and find creative ways to do that, you're really kind of cooking with gas. And conversely, if you can't, boy, you're fighting with one arm behind your back, or to mix metaphors, you're pushing water uphill a bit. I think those are the things that tomorrow can really help to support uterine health via good immune response and well-regulated inflammation.
No, and they're great points because it's practical, and it may not be new or modern, but it's the basic concept. So if you're struggling with a bout of uterine infections over the last few months, don't go chase some red herring, but look back and see what was happening. And you will be surprised that it was hot and it was overcrowded. And so that's the cost of doing business, and move on. And next time, remember what it costs and make the changes you can. No, I appreciate those very practical and sound recommendations, and for the background of what you've shared and of the things to come. It's exciting. So thank you very much for joining us today, for sharing some of your research and sharing also the reminder of what collaboration and leadership can bring, as you've exemplified in our industry, to move things forward. So thank you again.
Thanks, Chris. You're really kind. I'm glad we could do this.
Absolutely. And so, audience, thank you. Thank you very much for joining in and listening to us today. Reminder that you can subscribe to the Rumination podcast at jefo.ca. And so that you also don't miss past and future episodes of Rumination, look for us on Apple and Google Podcasts, as well, again, at jefo.ca, and finally on Spotify. This podcast was brought to you by Jefo Nutrition, precision nutrition for a growing world. And have a great day.